Abilify, generally known as aripiprazole, is a medication primarily used in the treatment of certain mental and mood disorders, including bipolar disorder, schizophrenia, Tourette syndrome, and as an adjunct in major depressive disorder. Approved by the FDA, Abilify is classified as an atypical antipsychotic. It works by helping to restore the balance of certain natural chemicals in the brain, which are called neurotransmitters, which can lead to an improvement in symptoms such as hallucinations, disorganized thinking, mood swings, and depressive states. While Abilify has been a critical tool in the management of these conditions, its use is accompanied by a spectrum of potential side effects and warnings that patients should be aware of. Abilify is used across a wide range of psychiatric conditions. It is effective in managing symptoms like delusions, hallucinations, and disorganized thinking. It can stabilize mood swings found in bipolar disorder, ranging from manic episodes to depressive lows. As an adjunct treatment, it helps when traditional antidepressants are not fully effective. It can help in managing uncontrollable muscle movements or verbal tics. It also helps with irritability associated with autistic disorder. It can reduce symptoms of aggression, mood swings, and temper tantrums. I had a pharmacist friend who had an autistic son who would sometimes pin her to the ground when he became angry. I recommended Abilify, and her son stopped this behavior soon after starting the drug. Abilify really can help. While Abilify is beneficial for many, it does come with potential side effects. Some of these common side effects include nausea, vomiting, constipation, headache, dizziness, drowsiness, feeling restless or jittery, insomnia, weight gain. Some individuals may also experience more severe side effects, such as uncontrollable muscle movements, known as tardive dyskinesia, significant mood swings, including worsening depression or suicidal thoughts, neuroleptic malignant syndrome, which is a rare but serious condition that can lead to death, characterized by fever, muscle rigidity, and confusion. Increases in blood sugar, which can be dangerous for patients with diabetes or at risk for developing diabetes. Before taking Abilify, it's essential to discuss your full medical history with your healthcare provider, especially if you have a history of diabetes, cardiovascular disease, seizures, or neuroleptic malignant syndrome. Abilify carries a black box warning, the FDA's most stringent warning, for an increased risk of death in elderly patients with dementia-related psychosis, and for an increased risk of suicidal thoughts and behaviors in children, adolescents, and young adults. Pregnant women should use Abilify only if the potential benefit justifies a potential risk to the fetus. It's also advised that women do not breastfeed while taking Abilify due to the potential for adverse effects in the nursing infant. Abilify can interact with other medications, which can either diminish effectiveness or increase side effects. It's crucial to inform your healthcare provider about all the medications you are taking, including over-the-counter drugs and herbal supplements. Abilify represents a significant advancement in the treatment of several psychiatric conditions. Its ability to help balance neurotransmitters in the brain offers relief to many who suffer from mental health disorders. However, the range of potential side effects and serious warnings associated with its use necessitate a careful and informed approach to treatment. Always consult with a healthcare provider for personalized advice and to ensure that Abilify is the right medication for your condition. With proper management and monitoring, Abilify can be an effective component of a comprehensive mental health treatment plan. If you've enjoyed this video, please give it a thumbs up. And if you want more information about medications, nutritional supplements, or just living a happier, healthier life, please subscribe to our channel. We release 3 new videos right here on YouTube each week. My name is Pharmacist Michael, be happy, and be healthy.